In the autumn of 1918, after 4 years of bloody conflict, the First World War was drawing to a close. At Étaples, a military camp in northern France, servicemen and nurses, many of them weakened by the appalling conditions at the front, began boarding trains and ferries to England. As the railway carriages pulled into Victoria Station, they were met by cheering crowds. But even as the war was ending, another battle was about to begin. And this time, the foe would be an invisible virus, the Spanish influenza.
It was within a few days of receiving some 200 patients from Paddington Infirmary that the great and awful influenza epidemic fell upon us, and under which the place literally reeled. Each day the difficulties became more pronounced as the patients increased and the nurses decreased. Sad to relate, some of these gallant girls lost their lives in this never-to-be-forgotten scourge.
Hood did not realise it at the time, but his staff were now locked in a deadly battle with the influenza virus. By November 1918, up to a third of the British population had been infected with Spanish flu. In 98% of cases, the illnesses were mild. But for 2 in 100, the virus sparked aggressive pneumonias and a condition known as cyanosis that turned patients' faces a purple-blue colour as their lungs filled with choking fluids, starving their bodies of oxygen. The cyanosis was a sure sign that death was imminent. St Marylebone was known as a training hospital for nurses, but during the war, half had volunteered for military service, leaving Hood with just 220 he could call on in an emergency.
All training, and indeed every sort of trimming, went by the board, whilst the staff fought like Trojans to feed the patients, scramble as best they could through the most elementary nursing, and keep the delirious in bed. I managed, by constant exhortation, to get the nursing staff to wear masks and to take some care not to interpose their faces too near the blast of those coughing. But when it came to nursing one of their own number, little that I could do or say had any effect. At the end of October, we lost our first nurse with influenzaal pneumonia. And then, on the 7th of November, I had to report the deaths of 4 more nurses, the last having only been with us 4 days. One poor nurse became so distressed she could not stay in bed and insisted on being propped up against the wall until she was finally drowned in her profuse, thin, blood-stained sputum. I knew she was doomed and that her end was near, so we did as she urgently desired us, making her as comfortable as possible. I have never really got over that time, and no wonder.
By December 1918, Hood had lost 7 nurses to the flu and was exhausted. Shortly before Christmas, he collapsed and was forced to take sick leave. When he returned in February, the outbreak was still raging, and to his dismay, he lost 2 more nurses. In all, St Marylebone admitted 850 flu patients during the influenza pandemic. In an era before vaccines and antibiotics, nearly half developed pneumonia and 197 died, 8 of them pregnant women, whose weakened immune systems made them especially susceptible to the flu. But this was a tiny fraction of the global death toll. Except for a handful of remote islands, no continent or country escaped the pandemic. Basil Hood retired in 1941 after 31 years as medical superintendent. During that time, St Marylebone ceased to be a poor law hospital, and in 1948 it joined the National Health Service. Hood never forgot the toll the flu had taken on his nursing staff, and in 1948, at the age of 72, he made one last entry in his notebook.
This epidemic was certainly the worst and most distressing occurrence of my professional life. Our helplessness now, 30 years later, would be nearly as great.
2018 marks the centenary of the end of the First World War. Every November, the nation pauses to honour the servicemen and women who laid down their lives in the Great War and other conflicts. The symbol of our remembrance of their sacrifice is the red poppy. But 2018 also marks the centenary of the Great Flu pandemic. Perhaps we should also use the occasion to remember the sacrifices of the forgotten fallen, the nurses and doctors who died battling the Spanish flu.